Hello, everybody. My name is Associate Professor Keith Lim, and I am the Group Head of Medical and Quality for IHH Healthcare. Welcome to our third Healthcare Insider for the year. At our last Healthcare Insider, we discussed how we embed sustainability at IHH Healthcare. Today, we want to share about another topic that is really important to us, which is quality in healthcare. At IHH Healthcare, putting patients first is more than just a value. It is our guiding principle. To share more about how we define and drive leadership in this area, I have invited some of our leaders across the group to join me today. We have with us this afternoon Ms. Elizabeth Han, Group Head Innovation and Transformation, IHH Healthcare; Ms. Hui Hua Koh Min Jut, Head of Allied Health and Patient Experience, IHH Healthcare Singapore; Dr. Lisa Maria Schwanker, Assistant Vice President, Medical Affairs and Quality, IHH Healthcare Malaysia; and Captain Sandhya Shankar Pandey, Chief of Nursing for Fortis Healthcare. Maybe we can start off today's session with each of you sharing a little bit about yourself and your work. Liz, if we can start with you.
Sure. Hi, everyone. Good afternoon, and thanks, Keith. So as Keith mentioned, I am the Group Head of Innovation and Transformation at IHH Healthcare. So let me talk about innovation first. While the two go hand in hand, what we're looking at in innovation is really how we can build and expand IHH's capabilities through two different ways. One is through investments, and the second is through partnerships. On the investment side, we function as the corporate venture arm for the group, looking at making early stage investments in digital health or healthcare technology enabled service businesses to really solve some of the problem statements and opportunities we see in healthcare today. On the partnership side, we look at how we can support our markets and understanding the different opportunities to build and develop new products and services, and by partnering with whether startups or large tech companies to deploy some of these solutions for patients and clinicians. Then moving on to the transformation side, while we look to implement some of the innovation across markets, in transformation, we're really looking at a broader scope of how do we change the way we work from an operating model, from looking at improving processes, increasing automation to make IHH more agile and position ourselves better for the next stage of our growth.
Thanks, Liz. Hui Hua, maybe you could introduce yourself next.
Hello, hi. So I'm heading up Allied Health and Patient Experience for IHH Healthcare Singapore. I'm a pharmacist by training, and having prior to this role, I've done. I was heading up Gleneagles Hospital as the CEO there. Well, really, having done both operational and corporate roles, I strongly have a deeper appreciation of the voice of the customer. And later, I think as we discuss about the quality of healthcare, I would like to emphasize about this point about listening to your customer, and both internal and external, to give us deeper insights in how we continuously improve in our quality of healthcare.
Thanks, Rihua. Dr. Lisa?
Thank you. Good afternoon and good morning, depending on your location. As introduced, I head the Medical Affairs and Quality for IHH Malaysia, where my primary focus is ensuring a strong clinical governance system. So this includes advancing clinical effectiveness, risk management, and safety, among other areas. I believe that to achieve this, it is important to foster a culture of excellence and a shared commitment in elevating patient care standards across our region.
Thanks, Lisa. And last but not least, Captain Sandhya?
Thank you, Dr. Keith. Hi, everyone. Greetings and lots of wishes on the occasion of Deepavali from Fortis and here from Gurugram Fortis Corporate Office. I'm Captain Sandhya Shankar Pandey and I head the nursing services for the Fortis Healthcare Group of Hospitals. And when I talk of nursing, it's all about care. It's all about the scientific and the logical care, which goes hand in hand with empathy, while delivered with a healing touch. This is something which is non negotiable. And another thing which synonymizes and symbolizes it well is the quality. So, quality, safety, bundled with care, and this is what we preach and we groom our nurses with when they embark their journeys with Fortis Healthcare. And in addition to nursing, I also contribute to quality in the capacity of principal assessor from with National Accreditation Board of Hospitals and Healthcare Providers. That's the NABH from Quality Council of India. Thank you.
Thank you, Captain. Before we proceed any further today, we want to hear from you, our audience out there in cyberspace. What does quality mean to you? We will be launching a poll shortly on your screen that you can see what are the top 3 aspects that you value when you seek treatment at a particular healthcare provider. In addition to this poll, you can always submit questions to us via the Zoom Q&A button at any point during our discussion, and we will address these questions as we go along in today's Healthcare Insider. Great, we're already getting responses. So in summary again, what we're trying to find out is what are the top 3 aspects do you value most when seeking treatment at a particular healthcare provider. And looking at the way the polls are going, we seem to be seeing the lead changing between execution of best practices and patient safety, excellent clinical standards and outcomes, and it looks like quality and reputation of the doctor is getting tied with excellent patient service. Okay, we'll give the poll a few more seconds and then we'll see where we end up. Thanks for your active participation, and it's really good to see that there's quite an interesting spread of answers which are going on the screen right now. Okay, so I think by now we've really got quite a clear result from our poll. And the number one thing is excellent clinical standards, quality and outcomes, followed by execution of best practices and patient safety, and following that, excellent patient service. 3 things which really resonate with us. And I think today we're really going to deep dive into how these 3 things we are executed in IHH Healthcare and how we really look into these sort of areas. Not to say the others are not important, and we'll also be addressing things from bill accuracy to the credibility and trustworthiness of our healthcare brand. So for today's session, we will focus, as I mentioned, on each of our panelists and their particular areas they will talk about. Dr. Lisa will cover clinical quality. Captain Sandhya will talk about patient safety. Hui Hua will take us on a deep dive into the patient service experience and excellence. And Elizabeth will cover innovation and how we transform ourselves. And I will speak a little bit about the clinical governance framework that we have in place in IHH Healthcare. The structure of today's episode will be broadly covering what we view as quality, followed by how we operationalize this in our business to build trust with our patients, and we will end with a discussion on how we maintain clinical and service excellence, especially in this environment that we're in with the rising healthcare cost. So, the big question today is how do we at IHH boil down what many would see as just a concept, to something we can measure, assess, and improve on. So maybe we can start with Dr. Lisa and Captain Sandhya. So Dr. Lisa, could you share your thoughts on how we actually are going to conceptualize and implement good quality care in IHH?
That's an excellent question to start this riveting conversation. I think it's perhaps useful to begin by defining what quality means. As we saw earlier from the poll, what is important can really vary from person to person. So, this is why we need a way to quantify what can sometimes feel slightly subjective. So in 2001, the Institute of Medicine, recognizing this challenge, introduced the 6 domains of healthcare quality, which continues to serve as a guiding principles to healthcare providers around the world. They are patient-centeredness, effectiveness, efficiency, timeliness, equitable care, and safety. Let me elaborate a little bit on each of these domains. So, patient centeredness. I think this should come as no surprise, as patients are the reason of our being. So, their needs and preferences are at the heart of everything we do. We personalize care and systems around the individual needs as much as possible and cognizant to preserve the human touch element, which is very crucial in healthcare. And important to note in this domain is also transparency. Living in the era of information, the provider needs to highlight information that is definitely pertinent and important to each individual patient. Patient deserves to be fully informed about their treatment, from outcomes and risks to potential complication and cost. And when we talk about costs, we don't just mean monetary costs, but also time costs. How long would it take for patients to recover? The second domain, effectiveness. Definitely, treatments must be evidence based and aligned with best practices, improving outcomes of every patient who come to us. And efficiency, as resources and management is definitely key. We must use resources judiciously while ensuring that care remains comprehensive and accessible. This ties in with the concept of sustainability, and this goes beyond our responsibility to reduce waste. It's about ensuring we can continue to provide quality care for our communities for generations to come and apply strategies that can support this. Timeliness, as you can imagine, delays in healthcare can be critical and costly. So we work very hard to minimize any waiting times and ensure prompt treatment. Equitable care. This is mainly focused on reducing variability in care despite the variability of our patient. Every patient, regardless of background or location, deserves the same standard of care. And last but not least, safety. Safety really underpins everything. Healthcare is a very complex environment and is notorious to have numerous hazards. And hence, we must ensure that our professionals and our infrastructures are well equipped to maintain the highest standards and patient safety. So, all of these domains are not just theoretical concepts, they are measurable and actionable. And at IHH, we integrate these principles into our clinical governance framework, and our governance structure promotes accountability at every level with policies and oversight committees that prioritize these domains. We measure our performance through a set of clinical indicators as well as other inputs which provide insights to inform decisions for us to continuously improve. So by consistently analyzing them, such as in our looking at our clinical outcomes, we ensure that we not only meet but definitely strive to exceed expectations of patient care. And I think this is how we transform quality from just a concept to something more tangible, measurable, and ultimately improvable.
Thanks, Dr. Lisa. Captain Sandhya, maybe I'll pose a question to you. What does quality healthcare mean to you?
Thank you. Thank you, Dr. Keith, for starting this session with both quality and care, very close to my heart. And as I see it, quality healthcare to me is all about creating process driven systems, which is primarily led by nurses, and practice by promoting improvement, fostering a culture of accountability. This is something sense of ownership in the nurses, and driving excellence, and also ensuring that each nurse, when engaging with their patients, should reflect the core values in every action of theirs, and that's empathy, respect, and dignity. And as a head of nursing of this large organization and one of the largest nursing teams in the country at Fortis, quality health care, especially for nurses, means ensuring that every patient receives a high quality and a high standard of care, which is marked by safe environment. Patients feels safe in the hands of their caregivers, and effective treatment, and of course care delivered through compassion. And it involves leading a team that is not only skilled, competent, and knowledgeable, but more importantly, it is committed to patient centric care. And probably nobody else except nurses who can drive this better in the hospital environment. And this also means innovating and adapting to the ever evolving healthcare system in the well being of patients and nurses when they drive from the forefront. But last but not the least, for me, most importantly, it is about creating a process driven system led by nurses, where nurses are satisfied and they are motivated to create a difference for their patients whom they care for.
Thank you, Captain. So let's try and tie all this together. So as many of you are aware, IHH Healthcare is one of the largest healthcare systems and providers in Asia, looking after over 83 hospitals across Asia. In order to ensure that our standards are consistent, we've had to come up with a set of brand standards, as you would say, which ensure that patients, regardless of which of our hospitals we go to, would get the same high qualities of care and patient safety that we would expect in any of our hospitals. As Dr. Lisa has mentioned, to achieve this, we have come up with a set of clinical indicators, as well as serious reportable events, which serve as our brand standard. We benchmark these clinical indicators against international standards, as you would find in the US and the UK, and we apply this to all our hospitals and to all our patients to ensure that as long as you come to an IHH hospital within our group, you are assured of a certain standard of care and the same level of safety as you would expect. We constantly measure and monitor these standards to ensure we are compliant with them. And as Lisa has mentioned, this is done at the hospital level, where we involve our nurses, our physicians, our allied health in multiple committees to see what is going on and what are we achieving. And then this goes up to the business unit or country levels, and then finally all the way to group and to the board. The whole idea of this is to have a system that encourages continuous improvement and ensures that patients receive world-class care. And whenever we have gaps, we address this and quickly deal with those issues. And on the same time, if we identify best practices, we quickly spread this across the group to ensure that everybody gets the same good clinical care. And so that's how we try and maintain our clinical governance system across IHH Healthcare. Now, in addition to this, we've also implemented value-based healthcare, which we will talk about a little bit more later, because we realize with the rising healthcare costs and the aging populations, things have to be different. We can't keep doing the same thing and expecting different results. And so, like most healthcare systems, we've also evolved to adopt value, where we measure what quality patients are getting and what it costs us and what it costs the patient to achieve this. And later on today, we'll be talking a little bit more about how value-based healthcare is now one of our major pillars in IHH. But moving on from this, let's go back to some other things which are really important to us, which is that patients receive exceptional service. Hui Hua, maybe I can bring this to you. How do you see and what does exceptional service mean to you?
Okay, thank you, Dr. Keith. Exceptional service actually, to me, starts with an exceptional team. So with our people-patient strategy, experience strategy, we have 4 very strategic priorities. The first one is building a service culture, and that may include things like rewards and recognitions that we do regularly. But beyond that, it's also about the equipping service professionals. So it's training, ensuring we have an IHH signature service, almost ingraining it into our DNA, especially for those in the front line. And also the other two areas are in ensuring quality consistency in our service. So that's where you spoke a bit about measuring, monitoring, and we audit and assess that area. And last but not least is design, enhancing the service design. So really, the service is not by chance, but really by design and areas to improve, to ensure the service is seamless and it's measured and reviewed, and it's a continuous effort.
Thanks, Wee Hua.
Yeah.
And thanks for calling to attention the importance of service excellence in healthcare. Healthcare is one would think, the most stressful times in a patient's life when they're actually having to deal with healthcare issues, the stress of whether this is affordable, what's going to happen to them, the fear of the unknown, and having exceptional service and staff which provides that service and commitment to service excellence is really important and very reassuring to our patients. And that's why in IHH Healthcare, we commend people like yourselves and the rest of our service teams who actually take this to the next level. So, but we have to constantly evolve, as I said. We can't just keep doing the same thing and expecting the similar results. And that's where innovation comes in. So Liz, maybe I could ask you, how are we leveraging on innovation to extend the continuum of our medical and services to ensure that we can contribute to better quality in healthcare and keep bringing us forward into the future?
I think that's a great question, Keith. So let me start by sharing, the objective of innovation and transformation, which I mentioned earlier, really go hand in hand, right? And that is really how do we transform IHH from being, a key private healthcare operator in each of our markets to becoming a healthcare clinical and thought leader. And what does that mean, right, for us? So we're looking at innovation and the impact it can have not only on clinical quality or service quality, but overall improving and enhancing the patient experience. So to us, the way we approach innovation is not looking at, okay, what are the latest, coolest, snazziest gadgets or toys we can give our doctors or put in our hospitals, but really how can we innovate to improve the way we deliver care, the quality of that care, or to ensure a more holistic and better patient experience. So let me give you an example of what that looks like in action, right? If I look at oncology, which is one of our key clinical pillars across our markets, it is something we are looking at from both the beginning of that patient journey for screening as well as through treatment and post-treatment monitoring. Right. As many of you know, those of you who are existing cancer survivors or those who have had family members with cancer, cancers can almost be seen as a chronic condition. It is a lifelong disease that requires constant monitoring. So we are longtime investors in a company called Lucence, which has developed a less invasive blood-based cancer screening and treatment selection product. And for those of you who have family members or have had cancer yourself, this test can provide a cost-effective way to screen yourself and those around you before you become symptomatic and display any signs of cancer. So this shows innovation on the pre-treatment, pre-diagnosis side. If I go further down in the patient journey for oncology patients, we have recently partnered with a company called Leo Cancer Care, which has developed an innovative way of delivering radiotherapy to patients, both photon and proton. Right? Instead of having patients lay down for CT scans as well as radiotherapy, which can be seen as a very vulnerable position for many of us, they can now be seated or be standing to receive that treatment, and the treatment time can further be reduced. So that is looking at how we can deliver more effective treatment in a more humane way to oncology patients. Another example I'll give is on the front of AI. I think as all of us have seen with the popularity of ChatGPT as well as large language models, we know there are many applications of generative AI across industries, and healthcare is no exception. I think we'll talk more about that later, but we have invested in and partnered with a number of AI companies that help with screening, triaging, and also diagnosis.
Thanks, Liz. And as an oncologist, I can say how incredible it has been that cancer has been transformed from something where people used to think of the word cancer as a death sentence into now a chronic disease. And that really is what innovation has done. We have changed how we are able to detect cancer, we've changed how we're able to treat cancer, and we've changed how we're able to monitor cancer. So that now patients are more assured that this is not the end of their life, but it's just beginning of another phase, but something that they will live with, as opposed to this is the and so that's where we are, because as we're saying, we can't just keep doing the same thing, expecting that's we have to keep progressing and moving forward. Speaking of progressing, as we're going through today's Healthcare Insider, just to remind all of you that we have our Zoom Q&A button open. And at any point of time, please feel free to leave a question for us, and we will definitely address these questions as we go along in our Q&A. But let's go on now to another critical part of quality in healthcare, which we did mention a little bit, which is on clinical standards and patient safety. This is really important to us because that's how we can build trust and know that we're actually doing a good job. So, Dr. Lisa, let's hear from you. How does IHH stay at the forefront of this domain of clinical excellence?
Thank you, Prof. I think aside from what Elizabeth has shared on innovation and technology advancement, I think IHH really adopts what I consider to be a holistic approach to continuous improvement. One that not only maintains but consistently pushes the boundaries of clinical excellence, which ultimately builds and preserves trust of our patients. So the first element I think which is very, very important is leadership. This is a critical driver of this process. At IHH, clinical excellence and continuous improvement are not just priorities. They are deeply embedded into our value system and as well as our policies. Our leadership consistently communicates and inspires a collective vision, and is supported by the necessary resources for us to achieve it, as well as the expertise needed to achieve these common goals. And that brings me to, of course, data-driven decisions. For leadership to drive improvement, they need to be informed and guided by data. This is where our clinical indicators play a really important role. To ensure that we have a clear understanding of our performance, we benchmark ourselves against high international standards. Currently, as you rightly mentioned earlier, we track clinical quality indicators covering areas such as healthcare-associated infections, patient safety, clinical effectiveness, and even timeliness. And in addition to that, we also monitor a series of reportable events, including critical safety incidents related to surgery, devices, patient protection, care management, environmental factors, and potential criminal events as well. I know this sounds like, a really nice concept. So maybe I'll share something close to home to give you an idea how this translates practically. One of our safety indicators that we monitor across IHH is pressure injuries. So for the benefit of the audience, a pressure injury, also known as a bed sore or pressure ulcer, is localized skin or tissue damage, typically over bony areas caused by prolonged pressure or friction. And they are very common in critical patients who are unable to move. It's a key indicator of quality nursing care, as it is prevented through regular repositioning, skin care, and patient monitoring reflects a proactive approach to patient safety and comfort. Rates for these injuries vary as low as 3% to even as high as 26% in some journals. So we benchmark against the target of 3%. However, since monitoring this indicator, our Malaysian rates has been well below this target. And we still continuously to strive to improve this number, even though we are below benchmark levels. And this outstanding result is really credited to our nurses, together with strong leadership support, who closely work with doctors, nutritionists, pharmacists, physiotherapists, and they apply a multidisciplinary approach to ensuring patients are safe in our care. And in our recent IHH Quality Summit, our clinical excellence champion demonstrated through their quality improvement project that they not only are able to prevent pressure injury, but they can actually reverse existing injuries which our patient may present with. This is truly a mark of excellence and dedication, and I think this dedication really permeates throughout IHH. So, in a nutshell, our shared visions and values, along with our governance framework, stakeholder engagement, and systems in place, really allow us to take the pulse of the organization and implement proactive risk mitigation strategies to ensure that we safeguard every patient that trusts us with their health and lives.
Thank you, Lisa. I like what you brought up about the safety issue, and that's really critical to us. So, in order, not only are we monitoring clinical outcomes, effectiveness, and timeliness, but also really important to us is the patient-acquired infections, preventing complications, and one would argue one of the most important roles in preventing that and ensuring that our patients do not suffer from any of these complications is the role of our nurses. So maybe Captain Sandhya, we can ask you, can you elaborate on the pivotal role that our nurses play in our healthcare system? We'll just hang on a
Sorry,
second. Yep.
yes, I was muted. I said, thank you, Prof. Nurses play certainly a pivotal role in guiding the patient journey by prioritizing patients and the family's well being. And this begins with a clear focus on the outcomes when the nurse starts thinking on how and where she wants to see her patient, his or her patient after the care and receiving the treatment. And this includes monitoring and measuring the nursing care compliances and nursing practice outcomes. And with this scientific approach, if I have to put it in simple words, it starts with the initial assessment at the time of admission. And we practice across the network these 8 aspects or 8 parameters of the nursing care which starts from the time of admission and continues till the patient exits, and this takes care of everything, because they say to start strong is a job half done, but a thorough initial assessment helps in identifying the key care areas, such as risk for developing pressure injuries in the hospital during the course of their hospitalization, or assessing the severity of fall risk in the hospital, identifying the level of consciousness of the patients, or when as simple devices like peripheral cannulas being applied on the patient's body, and identifying the risk of developing early phlebitis through scientific tools, determining the acuity, severity, and level of pain with the help of, again, smart tools, detecting early hypoglycemia, which is certainly an uncommon these are uncommon parameters right now, not very popular, but when we start focusing on these, certainly, they are very motivating for nurses to when they see the change in the patient condition by monitoring early hypoglycemia, and more importantly, monitoring the early warning signs to prevent further deterioration of the patients. And this is followed by a meticulous handover. And a good handover ensures continuity of care in all aspects. That's care, treatment, documentation, and patient education. And just to add on this segment here, it's to ensure effective incident reporting. We cultivate a supportive environment where nurses feel empowered to report incidences without fear of being reprimanded or without being intimidated. And just to share, in yesterday's nursing review, we landed up actually acknowledging 8 in charges of wards with chocolate goodie bags, and the CNO is more than happy to distribute them, and she had shared the photos as the first thing after her morning meeting, because these in charges stepped up to report the highest number of early phlebitis, and the rate of phlebitis certainly is little higher in their hospitals, but patients do not complain of pain and discomfort when they receive their antibiotics, IV infusions, and other medicines. And that's how, with these incident reporting, we believe in closing the loop by developing innovative and user-friendly tools developed by the nurses for the nurses to work more scientifically and empathetically.
Thank you very much, Captain. I'm sure the nurses appreciated the acknowledgement of what they had done and the chocolate baskets. As you heard, nurses are really critical to us. And at IHH Healthcare, we want to empower and acknowledge the vital role that they play in our healthcare system. So we work constantly to upskill our nurses, to give them those with the abilities, greater responsibilities, so that they can proactively help the doctors manage the patient, pick up incidents early and early warning signs so that we can quickly address these issues to prevent worsening of the complications or to prevent an incident from occurring to our patients. And that's really where our pivotal role our nurses play in our entire ecosystem and part of the prevent and ensuring that our patients have the safety standards that are expected. All this goes to ensure that IHH remains one of the world's most trusted healthcare systems, and building trust is really important to us. So we've heard about clinical, we've talked about safety, but Hui Hua, let's talk about service. Service is really important. That's what patients see when they first come in, what they experience, and really the impression that they leave with. So how is our service team evolving and changing to ensure that we are providing trust and instilling trust in our patients?
Well, let me maybe start with earlier mentioned about the IHH signature service. So in Singapore, we have programs like this course called Exceptional Team, Extraordinary Touch, and Respond to Service Recovery. These programs are provided not just for the new joiners, but and continue to enhance it with scenario-based training for existing staff. And in the scenario-based training, there is a methodology about, we call it LEAD, listening, empathizing, taking action, and then delighting the patient. All these sort of trainings that we have is really so that it becomes almost a day-to-day thing, and also to continue to maintain that is also listening to the voice of the customer. So we get patient feedbacks every day. It may be beyond just some patients would prefer to feedback maybe through a QR code. In the past was written, but nowadays we have QR codes where we straight away get the feedback. And while the patient is in flight or inpatient, we can respond straight away, even before the patient discharge or issues get elevated. And beyond that, these feedbacks are analyzed and reviewed internally with management. Voice of customer reports are actually generated to help us further look into deeper insights and deep dive into some of the areas that we can improve on in our processes. And aside from these things, it's the culture, right? The service culture, and to be able to build that into every department. We have service champions, and in the last 3 years, we have over 130 service champions that are the voice of the patient experience team, as well as providing the training to their departments. So they are the extra kind of hands and legs for us. Yeah.
Thanks, Hui Hua. And so you see, so that's how we're trying to ensure that the excellent service is there, and that we constantly ensure that as staff come in, join us, they're trained, they maintain that standards, and we ensure that patients throughout, not only in Singapore, Malaysia, everywhere in the system, receive that same level of excellence training. And I like what you've talked about, that you're really leveraging on technology to also help this service excellence move on. And that's another enabler to us. So we have not only the human touch, we have the technology that we have to enable our service excellence.
Yes.
So speaking of tech, Liz, we are really looking into also new techs that we can implement. And people always say we have to be cautious, we have to look into how innovation comes along. That's on one hand. And on the other hand, we hear people telling us we're not innovating fast enough. Innovation should move quickly. All of us in this call should be replaced with AI bots. Chatbots should replace all our people. We should have AI to replace doctors, and everything should be done on it. And we're not moving fast enough. So that's a criticism of healthcare, that we're not innovating fast enough. But we know that in healthcare, we have to be conscious when we innovate, that because patients' lives are at stake, we have to be safe. And as we move in our innovation journey, we can't just adopt, as you mentioned, the latest, newest toys and just bring that in. So maybe, Liz, you could share with us a little bit more about innovation, how we view innovation, our strategy, and some of the pitfalls and concerns that we have as we implement innovation in IHH.
Sure. First, I think I'd like to assure the audience by saying, at IHH, we don't think doctors are replaceable, and they're not going to be replaced by AI anytime soon. So let me start by saying, the way we look at innovation is really across three dimensions. The first is innovation in care delivery models. The second is looking at diagnostics and precision medicine. And the third is in payment models, right? But there's one area I like to dive deeper and really highlight, which is the patient trust part, right, as Keith mentioned. And I think as Keith knows very well, and other doctors also, when you become a doctor, one of the first things you have to swear by is do no harm by the patient. And that is the foundation upon which all of our clinical practices and patient experience is based on. But within innovation, we want to take it a step further. Beyond making sure patient safety is maintained, how do we strengthen patients' trust? Right? And let me break that down into both clinical and non-clinical applications of innovation, in particular for care delivery. So on the non-clinical side, which some of you may see as an easier application, within the field of AI and robotics, we're already across markets implementing AI for financial counseling. We're implementing robotics to deliver linens to our wards, or even to greet patients when they enter our hospitals, whether they need directions, whether they need help finding the right clinic. Now, once we move to the clinical side, this is where really patient safety becomes more important and looking at outcomes. But I think it's exciting because, as Lisa and Captain Sandia mentioned, right, one of the things we're looking at technology being able to do is to help with wound care, looking at how technology can help with not only fall prevention, but also detection, right? So for clinical applications, first, we have to ensure that if these products require regulatory approval, they have it in our respective markets. And even beyond that, we often look whether these products have FDA approval, which is kind of the gold baseline in the US, or CE mark, which is the baseline for Europe, right? So that in a way validates that the product has been tested by a regulatory body and is considered safe to be deployed in a live setting. After that, then we start looking at our own data and how do we ensure that the product we want to deploy fits in with our existing workflows and it can be accurate, can help with efficiency, and also standardization. So for that, we will often do pilots where we look at retrospective studies using the AI and comparing the results generated by that with that based on actual clinical practice. And after we ensure that the AI passes the test, then it's really about putting it into practice and ensuring that our nurses, our doctors, all our clinical staff, and even patient assistants know how to use the product, how to explain the product to patients and to doctors. So some of the applications we've implemented in the clinical setting include AI for triaging in radiology patients, to AI-guided echoes to help screen for patients who may have heart disease when they enter the A&E and complain of chest pain. On the diagnostic side, we've also looked at implementing wearables to help patients be able to diagnose sleep disorders in the comfort of their own home, as opposed to having to spend a night or two in an uncomfortable hospital bed for a sleep study. So Keith, these are some examples of ways we're trying to really consider the patient safety, the patient experience, as well as outcomes in implementing innovation.
It's pretty cool, Liz. So in a way, you're tying together both our clinical outcomes and our service quality. And I like what you mentioned about the wearable system that they can go home and do the sleep apnea testing, right? Which is, for any of you who have ever done it, it's a very different system from the traditional sleep study where you either have to do it in the hospital or you spend the night hooked up to multiple sensors across. And now we've got this new system which we have implemented within our group to allow people to have a sleep study at home in the comfort of their own bed and in a much more comfortable situation. So that's an example of something new that we're doing. And as we slowly roll out all this new innovation, we will be implementing this and bringing these practices across the group. But let's move on to, and as we talk about innovation and AI, I think we have to address the big elephant in the room, which is rising healthcare costs. We all know that healthcare costs is rising, and it's not just because of manpower costs, but material costs, electricity, water, everything is driving up healthcare costs. And this is being compounded by the fact that most of our countries around the world, we're moving from developing countries to developed countries, and with that comes the big problems of aging populations, the move from diseases which were communicable diseases to the non-communicable diseases, the lifestyle diseases like diabetes, cancer, heart disease. And we talked about it earlier, where cancer is now being a chronic disease, where it is treatable, it is controllable, but it is not cheap to maintain, and the amount of medications required and the testing is required does come with a cost. And that's why a lot of healthcare systems now are very worried. How sustainable are our healthcare systems, both in the government systems as well as in the private systems? How are we able to pay for this, and how are we able to manage all our populations? And so one way that people have been moving and looking into this is called value-based care. Value-based care to other industries is not new. When you buy a watch or you buy an iPhone, in a way you're already doing a value proposition. You're looking at what quality you get for what the cost you're paying for that phone or for that watch. For healthcare, it wasn't really something that was really part of healthcare until maybe about 10, 15 years ago, when people start saying we should also address that. So we have adopted the value equation, which is value equals to what quality and service you get divided by what it costs to achieve that. And when we look at it from the provider's point of view, like us, it is what quality and service we have achieved for our patient and what it costs us to achieve that. And for the patients, it's what value they got, it's what quality and service they received, and what it costs them to do it. Now, the big question obviously comes when you look at new technology and new drugs and new testing. People always say that, well, that's going to be very expensive. How are we ever going to afford that? And we will have to acknowledge that new tech, until such time as it becomes more mainstream and is able to monetize the cost over time, will be more expensive. But by looking and questioning ourselves when we talk and we introduce new technology and drugs, we have to ask ourselves, does it bring value? So does the new technology bring the quality that we expect at the cost of implementing that technology? And most of the time, for the stuff that we have implemented IHH, the answer is yes. In the short term, it may be more expensive. So definitely a robotic surgery may be more expensive than a traditional surgery, or a proton may be more expensive than traditional radiotherapy. But when we look at the cycle of care and we take into account readmission rates, complication rates, long-term time that patients have to take off for work, recovery time, that's what we need to look into when we look into the whole cost of care. And 90% of the time when we implement new technology and when people talk about value in healthcare, we have to look into that. So yes, there may be a short term more expensive, but in the long term, over the cost of care, it is value because the quality that you achieve is justified by the cost. But that's only one part of value-based care. The other part of value-based care is actually monitoring this and understanding what we get for how it costs, and then reducing unnecessary waste. And by that, we can control costs to ensure that our healthcare systems are sustainable. So at IHH, we are very actively monitoring what quality we get in order to identify best practices to share, and at what cost to identify these areas of waste that we can eliminate. And that is how we're really looking at trying to maintain and ensure that our healthcare system is sustainable and, as Lisa said, equitable for all. That people will be able to afford private healthcare and that people will be able to achieve these outcomes at a cost-effective price. So maybe I'll turn this over to Dr. Lisa again to share with us a little bit more about how Malaysia is implementing value-based care and what they have done and the achievements that they have done in their journey. Dr. Lisa?
Sure, Prof. Thanks. In Malaysia, again, it isn't just a single prong approach. We tackle this challenge with various strategies. I can perhaps highlight some of these more prominent ones than we do. I think a very important component is definitely engagement. We adopt clinical best practices through collaboration and efforts with our clinician through various hospital and central forums, such as our Central Clinical Governance Advisory Committee, where we discuss solutions to current common challenges. And one of such examples is maybe recommendation for antibiotic prophylaxis for surgery, for example, which definitely aligns with our antimicrobial stewardship goals. Second, of course, is redesign. We do a lot of quality improvement projects, which includes projects covering clinical excellence, service excellence, sustainability, and also patient safety. We have over 80 projects a year collectively, and many of them are geared towards cutting redundancies and redesigning processes for better efficiency, as well as waste reduction. And it's really great to see them share their success in the recent IHH Quality Summit in last September. Next, of course, is lean processes, operational excellence through structured lean Six Sigma approach, and also mapping key processes digitally is very important. It gives visibility of operational needs, such as nursing dashboards or emergency department dashboard, which allows teams to make real-time decisions to meet actual needs and demands, planning resources ahead and according to those needs. And of course, as you've mentioned, a more long-term effort in such is in value-based care or value-driven outcome initiatives, focusing towards improving patient outcomes and experiences, taking on a more procedure-centric approach. So since 2019, IHH Malaysia have analyzed various data to compare clinical outcomes with international benchmarks and patient reportable outcome measures, or also known as PROMs, ensuring both clinical and patient experience metrics are weighted and considered. So total, we have 6 procedures, and roughly going through them: colonoscopy, percutaneous coronary intervention, total knee replacement, laparoscopic cholecystectomy, ACL or anterior cruciate ligament repair, and hysterectomy. I know that we're running short of time, but let me just give one example of how this has brought value. For example, in the area of colonoscopy, in trying to improve the adenoma detection rate, we have actually strived and set in place standardized bowel prep requirements, improved cecal intubation rates, as well as polyp detection rates. And this, monitoring and analyzing of these data also gave rise to collaborative opportunity with the pathology team to align and standardize specimen fixation and staining, which then greatly, again, contributed to the improved adenoma detection rates as well as improved consistency of diagnosis. So there are really many more examples, but cognizant of time, let me hand it back to you, Dr. Keith.
Thank you, Lisa. So, as we were talking about value-based care and the rising costs, let's talk about payment models. So, Liz, maybe you can share with us a little bit how IHH is innovating on the payment model side.
Sure. Yeah, so I think tying to what Lisa mentioned just now and what I mentioned earlier about looking at innovation and payment models, right? We're already seeing this play out in other countries like the US, where there's greater collaboration between providers and payers and either risk-sharing models or capitated models. And I'm encouraged to see some of this starting to enter our markets. For instance, in Singapore, and those of you who live here may know, the government has rolled out a program called Healthier SG, which is really a way to manage the aging population at scale, right? And I'm proud to say our Shenton primary care group here in Singapore is an active participant in that program. So the way this program works, for those of you who are not familiar, every patient above a certain age is assigned a general practitioner in Singapore. And the reimbursement model or the payment model this GP receives from the government is based on how well and how effective they follow through with the patient in terms of not only annual health screenings or consults, but follow up based on their chronic conditions or whatever diseases they may have, as well as things like how well they adhere to treatment plans, medication protocols, and so on. And if the GP is very effective, they get a higher reimbursement. If they're not so effective, the reimbursement is lower. So this is an example already of how governments are taking an active role in not only managing population health, but they're also using payment models to be able to incentivize providers to do the same. If I look at other markets, for instance, in Malaysia, as Lisa mentioned, and I'm sure it wasn't easy to do, to create packages across certain procedures, whether it's a total knee replacement or a colonoscopy, requires a lot of analysis of data to make sure that whatever package we ultimately offer to patients and to also offer to payers can be standardized in a way standardizes the outcome as well the cost as well as the time that is spent in the OT, what consumables or what equipment is used, as well as managing the risk of readmissions and so on. So these are some examples. And again, cognizant of time, I'm going to turn it back to Keith.
Thanks, Liz. So we talked about the new payment models. We've talked about clinical standards. Let's talk about waste. So, Captain, how do we reduce waste and also ensure that patient safety is maintained by removing unnecessary practices? Maybe you can elaborate more about this.
Thank you. Actually, I was intently listening about the cost, which is the most familiar terminology and phenomena these days. But my focus and my efforts get converged on controlling the controllables, and that is preventing waste or minimizing waste. And this is this is one area where nurses can play a major role. And as a leader, patient safety is a core responsibility and non-negotiable priority. And you'll agree to it. And it's more than just following the protocols. It's more about creating the culture where nurses feel, they are encouraged to prioritize the patient's well-being, foster an environment where they feel empowered to report concerns, and also implement and try out good practices or the best practices without inhibitions. The link between the patient safety and the resource management is also crucial. And waste there comes where in the form of unnecessary procedures, medication errors, other errors, as well as preventable complications or patient deterioration, which not only inflate the cost of the treatment but also endangers the patient outcomes. Although unsafe care globally ranks among the top causes of death and disability in the hospitals, as reported in the WHO annual report, it's the hospital acquired infections which increase the length of the stay of the patients, where probably nurses play a major role. And beyond the financial implications, this also leads to the loss of productivity when their morals, as well as gives rise to a very unknown category of employees or healthcare workers called the second victims. Also, and we may term it human sufferings. So, putting it in a nutshell, by optimizing processes, minimizing errors, focusing on preventing the errors, and leaning the processes again, leaders, nurse managers can reduce the costs, improving the patient outcomes, and ensure that the resources are used effectively. I'll just give one example. Rather than measuring the medication errors in the hospitals, we also did two things. We disciplined ourselves on 5 mandates of medication administration, on what to do and how to administer medication, on 5 simple steps. And along with this, we started monitoring and measuring the near miss medication errors, near miss through prescription, transcription, indenting, and administration. Now we saw the list of near miss was huge and it's increasing every day. And we started acknowledging nurses on preventing these medication errors by stopping them reaching to patients and causing further harm. And this brought in such amazing results and also helped the organization in bringing down the medication administration errors. And we are really proud of our nurses in achieving this. Probably this is how we work in a team, as a team, towards adding value to patient care and the treatment they receive in the facilities.
Thanks, Captain.
Thank you.
So as you can see, that waste is not just doing unnecessary things like ordering unnecessary x-rays or wasting expired medication, but also wasting time and wasting resources to treat complications that did not need to occur. So when we talk about reducing waste in healthcare and how to provide value, it's not just about looking after what resources we're using, but also about ensuring that the patients get what is necessary and we don't have to treat unnecessary things that we could have prevented.
Absolutely.
But turning to Hui Hua, value is, as we mentioned, quality plus service over what it costs us. So let's talk about the service. So how do we ensure that patients feel that they're getting the service and the value that they expect?
Okay. Well, from a service point of view, we look at some measurements like customer satisfaction score, net promoter scores, and these are really international standards, and we benchmark. So most recently, we did a benchmark study comparing with other hospitals in Singapore, and I'm very proud to say that IHH Singapore, 4 hospitals rank in the first 4 positions. But never rest on our laurels, right? There will always be areas for us to improve. So through all these, as I mentioned earlier about the voice of customers, we continue to look at some of the challenges and the feedbacks also that we receive from our nurses and allied health staff. We will look at using methodologies like design thinking, conduct workshops to be able to solve some of just day-to-day operational issues. And at the end of the day is then how do you operationalize empathy, right? To be able to bring better service and value to the patient. So as we continue to measure these scores and we see good results and that has continued to improve. But it's patient expectations continue to rise. So, like I think Elizabeth talked about AI and, there are expectations that they want things faster. And so where things that are very transactional, can we automate, right? So that we can upskill our staff to do other things. So really, I think healthcare is about going to be more AI enabled, and it'll help us do things faster, better.
Thanks, Yuhua. And so we mustn't forget when we talk about value and when we look at the outcomes, it is outcomes that matter to the patient. And really service and experience really matters, is really important to them. That's why at IHH, when we measure value, we not only look at the clinical outcomes that we get, but we also look at 2 other big things. One, what is the patient experience? So we actually track what is the experience that the patient got, the feedback that they gave us, the net promoter score, the total experience index in some of our markets, and also their functional outcomes, as Lisa mentioned. So what is the patient-reported outcome measures? How well are they doing? So we don't want to know that you survived the operation, that you went home, but we want to know how functional you are. How fast are you back on your feet? Are you out in the market? Are you out in your work? Or are you at home? And that's important to us. And most importantly also, what experience did you have? Were your needs met when you were in the hospital? Was it an experience that, while you wouldn't wish on anybody else, it's something that you would recommend? And that's very important to us. So that's why how we look at value. Again, it's quality plus service over the cost. And that's why we have to all work together to ensure that we are achieving value for our patients. Now, before we wrap up today's session, I'm going to address some of the questions that you guys have been giving us through the Zoom Q&A. I think some of the questions have been answered already, how we're sharing best practices through our forums, sharing through our multiple meetings, and in our countries, we have different committees as well as across countries, we have quality summits, and for the physicians and for the nurses, we have nursing meetings across countries, and also for the physicians, we have medical symposiums. And some of the other questions that we've talked about, how we're changing our healthcare models to try and deal with the changing healthcare payment models, and we have to adapt and adopt those new systems. But I like what was asked about this. So how can healthcare organizations prioritize sustainability and innovation? We talked about sustainability in the last Healthcare Insider and what we're doing as a healthcare provider. But what eco-friendly innovations can help us reduce healthcare's environmental impact? Maybe Liz, I'll turn that over to you. What are we looking at in trying to reduce our environmental footprint?
So I think it's a great question. Obviously, something top of mind for us as well, because as we all know, healthcare providers are probably one of the leading contributors to a lot of the factors that affect not only sustainability but also climate change and similar things, right? So from an innovation perspective, there are 2 sides we're trying to balance. With any new technology, there is probably some cases a negative short-term impact, right, to sustainability. For instance, if you look at AI and with what's happening with all of the new Gen AI solutions, there's been a massive competition across the globe to secure servers, GPUs, which is obviously a detrimental impact to the environment, right? In terms of the energy it requires to run these and process large data sets. But if we look at the longer term, we do see benefits as some of these technologies emerge and become more cost effective as well as more environmentally friendly. So on a given example, one of the things that have taken years to develop is solar energy, right? And it's something we have started to implement across our hospitals, especially in Malaysia. So we all know that hospitals consume a massive amount of energy, but in order to offset that and try to become more balanced and sometimes produce energy, we have installed solar panels in a lot of our hospitals. And one, I guess, benefit of global warming is that there's a lot more heat for us to absorb and transform into energy that's usable. And so the idea is to really, how do we become more sustainable by adopting some of the innovation, whether it's in clean tech, looking at financial services and other industries, and apply it so that we don't contribute as much to sustainable, issues.
Thanks, Liz. So it's about looking at the new technology we adopt, its impact, and we're looking at new ways of getting clean energy into our systems, right? It's not only, and in addition to that, I'm going to elaborate a little bit more about this. We also have to look into our healthcare models. So as Captain said, it's about looking at how we do things and where are the waste coming in. So there are a couple of things that we're doing, and I'm sure most of you may be aware of the carbon impact of anesthesia gases. So that's one thing we're doing. So in a way, that's innovation, because we are changing the sort of gases we're using to try and use more gases which are good for the environment. We've found that they have no clinical negative impact, and so we are really adopting this by changing a lot of our gases to the more carbon-friendly gases out there. The other things we're doing is that talking about waste is reducing unnecessary practices. One big thing is the use of gowns. So all of you will be familiar during the COVID, everybody was using personal protective equipment, gowns were everywhere. The sheer amount of carbon waste that was generated during that period is astronomical. Over time, now that COVID has gone away, we're actually having to relook at, do we really need gowns for every situation? And there's a big body of medical evidence out there that there may be in certain situations where gowns are not required. And that not only saves the carbon amount, the wastage of using these gowns and disposing these gowns, but also the time for our staff to actually put on gowns and inconvenience of doing that. So we are actively looking into new models where we can keep it safe for both our staff and our patients, and also reduce the use of gowns. So these are examples of not new innovations, but innovating our models of care to actually try and be more sustainable and better for the environment. So thanks again for that question. I think in the interest of time, we'll probably bring this session to a close. And once again, I'd like to thank all my panelists for their time and all their insights. Dr. Lisa, Captain Sandhya, Hui Hua, and Elizabeth, thank you all very much for your time and your insights that you shared with us. We will also be putting up a QR code for any feedback that you could give us, and we look forward to further feedback and to seeing all of you at our next Healthcare Insider Summit. And to our Indian colleagues out there, we would like to wish all of you a happy Diwali and best wishes for this wonderful season, upcoming Christmas, and a happy New Year. Thank you all very much.